So, is Chat GPT taking over my job as a dentist? Well, the reality is that AI actually is already very regularly used within our practice. I use it every day, and it has significantly increased the rate at which patients can predictably finish treatment, like orthodontics. It's being integrated into reading and interpreting x-rays. It's taking data-rich tasks that would take dentists hours previously and synthesizing them down into simple reports we can review in a matter of minutes. Everybody's talking about Chat GPT. Chat GPT, that's the one. So I'm curious how well this AI tool could actually be utilized in its current form in dentistry. Rundown of what Chat GPT is in case you've been living under a rock. The GPT stands for Generative Pre-training Transformer, and it's a language model created by the company OpenAI. It's designed for natural language processing tasks. This includes understanding, translating, and generating. The thing with most AI models and technologies used within dentistry is that it's been trained on a number of data points, but also it's been trained through clinicians teaching the AI what looks normal and what doesn't. And so something like ChatGPT hasn't been through that rigorous clinical testing. So this should be pretty interesting. When I asked ChatGPT how it's going to replace me as a dentist, it said that it could automate patient communication, generate dental report, provide patient education, and conduct data analysis. The thing is, it gave the caveat that you would require a GPT-like model. You can pay to have a specific model created under their technology, but in its current form, it's not designed for dentistry. Let's see in its current form just exactly what it can do. I think it will be strong on some points, but I think in other areas it will struggle a little bit. This is my ChatGPT. Yes, do my tabs give you anxiety? Because this is how my brain works. Well, I'm gonna ask it a couple of tasks and see how well it can do. Let's give it a rating out of 1 to 10 as to whether it's passable with what it comes back with. Please create a comprehensive, be helpful if I could type faster, and clean notes template. I already have a notes template that I use through an AI dental note making software currently. So I'm interested to see how detailed this is because I write very detailed notes. But I do find that I end up repeating myself a lot. And so I have different buttons that are linked to different responses that will be auto-generated further down the documentation. I probably should have specified that I was asking for a comprehensive dental checkup and clean, not a generalized one, because I am not looking at the lungs or the heart or the abdomen or extremities on a regular basis. And if I am, something has drastically gone wrong. Dental. This is the first time I've done this, so I'm pretty interested to see what comes out. That's interesting. So, my critiques. Patient name, probably not that relevant because ultimately it's all a digital file and you've already confirmed when you brought the patient into the room, is it the right patient? Is it the right date of birth? Because you'll be amazed how many Laura Browns there are out there. Chief complaint, yes. Medical history, yeah, that's pretty good. I do think current medications, allergies, past dental history, maybe something about like past medical history because potentially things could be quite relevant within that, but look, I think this is passable. I would give it like a 6 out of 10 because you have everything needed to cover your bases. It's not my level of notes, but it's pretty good. Vital signs, to be fair, a lot of people are saying in the space of dentistry, if your patients are older, we should be checking their blood pressure and their heart rate, almost as a courtesy, because if they are seeing their dentist on a regular basis, it's a good track record for them to have, and if we notice fluctuations, then we can refer them out to see a GP. I would probably say a bit more in the extra oral exam, so all the fundamentals are there. I think that's the thing. I'm really impressed by the intraoral exam, the fact that they have hit a lot of the spaces of the soft tissues, like the lips, the tongue, the oral mucosa, floor of mouth, palate. I don't know if I would use this as like a first time seeing a patient notes, but for a routine checkup and clean review, not bad, not bad. I wouldn't call it comprehensive, but it's passable. Let's do a new one. Write dental clinical notes about a clean done with an EMS airflow. The thing about an airflow is that it is a special type of cleaning system that's all about guided biofilm therapy. So while it's generating that, let's see what it says. So there are a few steps involved. Let me tell you them and then let's see how accurate this was. So you start off, do a general check of the oral mucosa, make sure that everything's looking healthy, bit of a probing of the gums, bit of a gum screening, and then you go in with a special dye that is a disclosing dye. It shows us the exact location of where the biofilm is in the mouth, which is basically the slimy, furry feeling that you get on your teeth. And that's a community of bacteria that can lead to gum disease and decay, all kinds of really not fun things. Once we've done that, we'll then go through with the EMS airflow and clean that biofilm off. Then we'll remove the calculus, which is the hardened biofilm, with a piezotron ultrasonic that's associated with the system. And then to finish off, we'll normally do a hand scale, a floss, and apply fluoride. So let's see what it says. Okay, number 1, weird layout. Don't love it. Patient presented for a routine dental cleaning. The cleaning was performed with an EMS airflow, which uses a combination... Oh, it's giving us a whole little story! Which uses a combination of air, water, and powder to remove plaque and stains from teeth. True. The device was adjusted to the appropriate settings for the patient's needs. Okay, fair. But normally we would write down what they are, but I haven't given it to it, so I will be fair. The cleaning was well tolerated by the patient. What a dream patient! I love this! And they reported no discomfort during the procedure. I feel like EMS has written this. It sounds like a piece of marketing. The teeth were thoroughly cleaned and polished, and the patient was instructed on the proper oral hygiene techniques to maintain their oral health. No issues or concerns were noted during the cleaning. It's a little bit light on details, but I do like the positive flair. It's really painting the dream picture here, isn't it? I would give that a 4. If I was referring that patient to anyone else and they read that, it would not give them very much information other than the patient enjoyed the clean and how the airflow works, which hopefully they already know. Let's take it up a notch. Please write dental notes for a surgical extraction of the wisdom tooth. 3A is my least favorite out of like the numbers because I feel like it's just, I don't know. It really loves to write like a full patient experience story. To be fair, this is better than some dentist notes that I've seen. Preoperative diagnosis, you probably want a little bit more of a genuine reason for needing to extract it. So if I was documenting the reason, I would say high caries risk or recurrent episodes of pericoronitis. But admittedly, I didn't tell it the reason why we're extracting it. Procedure, surgical extraction. Yep, that's true. That is, I would probably have put something about medical history as well, because if we're going to be doing a surgical procedure, Chat GPT, we should probably know that about the patient. The patient was taken to the operatory. I have never referred to my room as an operatory. Interesting. Placed in a supine position. Great. Local anesthetic administered to the area. Good, but it doesn't tell us how much. But again, I didn't tell it, but I would also hope that it would have a bit of a blank so you could fill in that detail of the type, the adrenaline content, the concentration, the amount that you used, where did you actually inject it, because those things are actually important. A full thickness flap was elevated and the impacted wisdom tooth was luxated and removed. It's getting the processes right, and the sockets curetted and irrigation was performed. Great. I would probably say what it was irrigated with. From a legal perspective, the flap was repositioned and sutured. Great. You probably need to say what suture you used because that is important. Post-op instructions. Yeah, that's right with the gauze biting. Avoid solid foods, correct. Soft diet for the next few days, all over it. Prescription, if we're giving a prescription, we need to also have those details. One big thing that I would include in that as well is if the bleeding hasn't stopped in the next 24 hours, particularly for older patients who are on medications that thin the blood, that they should come back or they should present to hospital, depending on whatever is available. It's not terrible. I would give it a 5. I feel like this is quite useful as a jump-off point to make templates. So please write clinical notes about a Invisalign consult for a patient called You know what? Let's go with my name. Amelia Judson, who is unhappy with the crowding of her lower teeth and has a class 1 molar occlusion. How about that? Okay. Damn, ChatGPT's really good. It's making some assumptions here. I love the fact ChatGPT has not done a clinical examination on me, and already it's guessing that my estimated treatment time is going to be 12 to 18 months. Okay, let's break this down. Dental history, class 1 occlusion is a clinical finding and not a history. Crowding of lower incisors and premolars. It's doing a bit much, making a few assumptions here. I'm glad that it thinks I have good oral hygiene, but it's interesting that it's decided that I have a mild overbite and overjet. I don't think you could necessarily just guess that based on that information. I do think it definitely takes liberties. Treatment plan, I think you would need to give the option of Invisalign and braces so that you have given the patient all of the options so that you can achieve informed consent. Look, I do think that it gives the overall crux of what needs to be there. I will give it a 6. I'm just impressed that it can diagnose things that I haven't even seen. I love the disclosure down the bottom that it should be noted that this is just an example and the treatment plan may vary from patient to patient. All right, next challenge. Please write a endodontic referral for a patient with a periapical radiolucency on a 2-6 that has been them severe pain for the last 2 weeks. Not bad. I tend to write a lot more. I feel like what we've taken away from this is that I write really, really long notes and referrals. Look, I think for a quick referral, it's actually not bad. Most of the time, I send the referral as like a courtesy, and I'm sending people like voice memos on WhatsApp to just confirm the details with them. I'm referring my patient name to your office for endodontic re-evaluation and treatment. Patient has been experiencing severe pain for the last 2 weeks. Radiograph examination confirmed the presence of the... Well, that's good that it's been confirmed. It is missing any note of a vitality test, because if you're going to refer it off... Look, it's not the end of the earth. If you're thinking that they need a root canal, you should have done a vitality test where you tap the tooth, palpate the tooth, check if the tooth responds to cold or hot things. Please evaluate my patient and provide appropriate treatment, including, but not limited to, root canal therapy. Yeah, I think that's nice. I always sign off saying thank you for your time and attention to this matter. For me personally, the thing that takes the most time is just all that fluff. I'm always going to finish off with please evaluate and blah, 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 blah. I'll always finish off with this area down the bottom. So having that there as a template makes it so much easier, and it's quick, you know, because then I can go through and just fill in the information. And that's what I really like about the AI platform that I'm using at the moment called Kuroku. All right, last but not least, let's see how it goes explaining different things to patients, because patients always want more information. Please write an email to a patient explaining the difference between composite resin veneers and porcelain veneers. Oh, that doesn't look good. Maybe I won't tell it to write an email. Please write an explanation for a patient about... I love it when it thinks. It's like, will I or won't I? In this case, it has. Composite resin veneers and porcelain veneers are both types of dental veneers that are used to improve the appearance of the teeth. Composite resin veneers are made from a mixture of plastic and fine glass particles. They are directly placed on the surface of the tooth and then shaped and polished to look like natural teeth. They are less expensive than porcelain veneers and can be placed in a single visit to the dentist. They are more likely to stain over time and need to be replaced more frequently than porcelain veneers. Oh shit, I forgot to give a rating for the last referral. The last referral I would have given a 7. Porcelain veneers, on the other hand, are made from thin, custom-made shells of dental porcelain that are designed to fit over the front surface of the tooth. They are stronger and more durable than composite resin and are more resistant to staining. Porcelain veneers also mimic the light reflecting properties of natural teeth, making them look more natural. The process of getting porcelain veneers typically requires 2 or more visits to the dentist. They are more expensive than composite resin, but they last longer. In summary, composite resin veneers are less expensive and can be placed in a single visit, but porcelain veneers are stronger and more durable and look more natural. Your dentist will discuss with you which type is best for your individual needs. Very diplomatic, very good response. I would give that a 9. I think this is where this sort of software really shines through. Now, you do need to fact check it. It got majority of this right. Traditionally, composite veneers have been a one visit appointment, but nowadays with digital planning, I'll always be doing diagnostics beforehand. Often we'll do a mock-up beforehand as well, because you want to make sure people are happy with the design before you go on and start layering porcelain. With the light reflecting properties, I think if you're doing the standard veneers made of composite, yes. But I use a couple of different systems that are different densities, so they're very good at mimicking the light as well, and you can use different pigments and it's a lot more artistry. But overall, it's pretty accurate, you know? I am honestly really excited to see how AI changes our industry in the future. I know it's kind of stressful, and I also don't want to be murdered by robots. I already in the last 2 years within my practice that I work at have seen such rapid changes. Like some of the pilot programs we're testing at the moment, it's just mind-blowing what you're capable to do with even something like an iPhone. Technology really takes a lot of the human error out of it, because ultimately there is some of that ingrained in what we do. We might be having a shitty day, or we've just gone through a breakup, or somebody cut us off in the traffic in the morning. It means that you can take an unclouded look at the analysis of the data and then from there interpret. I think it's so powerful. And also, it means that patients don't have to come and see us as much. It saves them time. It makes treatment more efficient. I see AI very much as the horse, and I am the rider as the clinician. And so as we go forth, rather than being crushed by that wave of technology, I think it's so important that we harness that. It's exciting, and it's pushing the barriers of what's physically possible with the human body. It's honestly wild. But I do think after today, Chat GPT, I get to keep my job. And I'm happy about that because I love my job.